Good afternoon, everyone. My name is Marla McGuinness, and I'll be your moderator for today's media availability. Premier Houston is joining us today. He has very limited availability, so we'll do our best to make it to each reporter that has registered with questions, but we do apologize if we cannot make it to each one of you. We'll jump right into questions now, and we'll begin with Mike Gorman with CBC. Go ahead, Mike.
Thanks, Premier. We're just now sort of getting details about what the feds have offered the provinces. So could you start by giving us your initial reaction to the offer and what your understanding is of what it would mean specifically for Nova Scotia?
Yeah, thanks very much, Michael. So look, here's what I'd say. Productive meeting with the federal government. I was very pleased with the structure of the way they want to fund healthcare, assist in the funding of healthcare going forward. And they came with a fulsome presentation, a whole booklet, which was very helpful, actually. So I think, look, it's healthcare is expensive. We're spending a significant amount on healthcare. We'll continue to spend more and more on healthcare. So the federal government's recognition of that, of the burden of the cost on the province is an important thing. And they've done that to some degree today with the proposal to the provinces. So specifically for Nova Scotia, it would mean about $154 million of new money in this year. So 154 for this year. Going forward, that it's $100 million in the next couple of years. But it's new money. It's significant money that's necessary for the funding of healthcare. Our costs will go up faster than that new money will be. That money will be absorbed very quickly with the cost of healthcare. But I thought it was a productive meeting.
And just as a follow-up, if I may, Premier, do you have a sense of how you would use that money, and what conversations are you having with Ottawa about potential bilateral agreements? Because we're hearing reports that along with increasing transfers, Ottawa also wants separate bilaterals.
Yeah, so just to be clear, so that would, the 154 would include the bilaterals. That's the full picture for the impact on Nova Scotia. So, and that's against the backdrop of a roughly $6 billion budget. So the bilateral agreements, look, I have no issue with the bilateral agreements. It's a focus on access to primary care. It's a focus on issues that matter to Nova Scotians. So we're aligned on the outcomes here with the federal government. So I have no concerns about the structure of the bilateral agreements, but the quantum for them is included in that number that I shared.
Next, we'll go to Stephanie Seacos with CTV. Go ahead, Stephanie. Okay, next we'll go to Alicia Drous with Global. Go ahead, Alicia.
Thank you. So, Premier, I'm just wondering if you can maybe break down if the province already has plans on how you might be spending this money.
Yeah, so look, it's new money from the federal government, the 154 million, and so they want that to be incremental investment in healthcare. So that's okay with us. We're making all kinds of incremental investments in healthcare. So some of on the primary care, some of that stuff could be health human resources. It could be kind of a modernization, investments in technology. So just in the last couple of weeks, we of course announced One Patient, One Record. Those types of technology investments will continue. But look, there's no shortage of need to invest in healthcare. So I know we can certainly work with the federal government on the bilaterals. I have zero concerns about that part of it.
And was there anything, I guess, that you were disappointed or that you had been hoping for that doesn't seem to be panning out?
Yeah, so listen, on the quantum, I always want more for Nova Scotia. I'll always push really hard for more for Nova Scotia. So, that's an area where I would have, of course, been pleased to see more. But we'll work with what's in front of us, and we'll be focused on delivering healthcare to Nova Scotians, making sure Nova Scotians can access the healthcare they need, where they need it. That's my number one focus, and that will continue to be my number one focus. I always want more for Nova Scotia, but we'll work with what we have.
Next, we'll go to Frank Campbell with the Chronicle Herald. Go ahead, Frank.
Hi, Premier. The 154 million and the bilateral agreements, so this will all be part of the budget coming up in the spring?
Yeah, that's the expectation. So just for clarity, so we're going through the package, and we'll have follow-up questions from the federal government. But my initial read is the 154 million would be broken down as 52 million as an increase to the CHT and 102 million in the bilateral agreement. So, but yeah, the expectation is that we can move pretty quickly with the federal government, and those numbers would be included in the upcoming budget this spring.
And the
Frank,
100.
you have a follow-up?
Yes, please. Yeah, the 100 million going forward, is that a one time or continuing? Or
no, the part that seems to be one time would be the 52 million, the top up to the CHT this year. That's how the federal government kind of described that, and then the 102 million in the bilaterals that does extend out into the out years. So that would be there.
Okay, next we'll go to Paul Bacon with All Nova Scotia. Go ahead, Paul. Paul, are you there? Okay, next we'll go to Nicholas Steinbach with Radio Canada. Go ahead, Nicholas.
Hi, Premier Houston, do you hear me?
Yeah, I have you. Yeah, no problem.
Okay.
Nicholas, go ahead.
Hey, sorry, I missed the beginning of your press conference. Could you just recap what's your reaction? Is that a good news for your province, and how, or not? And how is that a good news for your province?
Yeah, so thank you for that. So I always want more good news for Nova Scotia. So we'll always push more for Nova Scotians. Healthcare is our number one focus. So the meetings today were, I would call them productive. The federal government confirmed existing investments in healthcare, which is good. They shared some information about some new investments in healthcare, which for Nova Scotia works out to about 154 million this year. So look, there's the needs in healthcare are pretty significant. We that money can be certainly used to improve healthcare in Nova Scotia, that and a lot of money that we'll add to it as well. But I would consider it a productive meeting today.
So if I understand well, it's 154 million this year, so 2023 in new money for Nova Scotia, and is that going to be 150 every year for the next 10 years for Nova Scotia of new money for the province?
No, so that it's 154 this year, and then next year and the out years it's 100. There was a one-time top up to the CHT presented today, so. There's a lot of details in the presentation that was provided, so we'll continue to go through that, but that's my understanding as I sit here today.
Okay, I just want to jump back to Stephanie Seacoast with CTV. Stephanie, are you there, and do you have questions?
I'm just monitoring for today. Thank you, though.
Okay, thank you very much. And let's jump back to Paul Bacon with All Nova Scotia. Paul, are you there, and do you have questions?
Can you hear me?
Yes.
Okay, great. Premier, all the Atlantic provinces have been talking about a change in the funding formula to try to recognize the aging population, the unwell population we have here. Any sense of movement on that, federal government today?
Yeah, a little inching, I guess, along. We would say the funding, the traditional funding model, that the CHT portion of it, which is on a straight up per capita basis, it's harmful to Nova Scotia because of our demographics, because we're a smaller province for a number of reasons. So the CHT, there is still the CHT going forward. There's also under the bilaterals. The bilateral calculation includes a fixed portion and a per capita, so there's still even per capita in the bilaterals, but there is a fixed portion, which is a little sliver towards recognizing that it can't all be just on per capita because some of the fixed costs are there as well. So I would call that a little sliver of movement towards recognizing the disadvantages of a straight up per capita system. So I'm pleased with that recognition in today's proposal.
Paul, do you have a follow-up? Sorry, Paul, did you have a follow-up question?
No, I'm good, thank you.
Okay, great. Unfortunately, that is all the time we have today.
Can we get one quick piece of clarification on this deal? Sorry, I know the Premier's got to go, but Premier, you're talking about this as a proposal. Is this a done deal for Nova Scotia, or is this pending some type of formal agreement by all of the premiers?
Yeah, so I think even the Prime Minister himself has said that there wouldn't be anything signed today. So look, they presented a lot of information today. We'll go through it. We'll have discussions with the federal government. But the structure I think makes sense with the two buckets. The quantum is what it is. As I said, I'd always want more for Nova Scotia, but there's definitely a process to go through to formalize this.
Thank
Okay,
you.
that is all the time we have. Thank you very much, Premier, and thank you all for joining us.
Thanks, everyone. Thank you.